The Most Honorable Janet Phillips, Director General, Social and Environmental Policy. Mr. Wayne Marshall, Permanent Secretary, Ministry of Health and Wellness. Dr. the Most Honorable Kenneth George, Chief Medical Officer. Dr. Amalio Del Riego, PAHO WHO Representative for Barbados in the Caribbean. Dr. Lisa Indar, Chief Executive Officer, CARPHA. Dr. Mark Sami, Director of Corporate Services, CARPHA. Other CARPHA staff. Dr. Walter Aline, Senior Medical Officer, NCDs. Mrs. Rashima Cheltenham-Niles, Director, Planning and Research. Major Joel Greenidge, Project Officer, Office of Director General. Dr. Brian McLaughlin, Senior Consultant Psychiatrist, Psychiatric Hospital. Other members of Ministry of Health and Wellness staff. Other members of CARPHA staff. Other members of PAHO staff, specially invited guests, the media, ladies and gentlemen. It is my pleasure to welcome you to the media launch of the 69th Annual CARPHA Health Research Conference. This conference remains the Caribbean's premier platform for sharing scientific research that informs policies and interventions to improve health outcomes across our region. It is an honor for Barbados to host this launch today at the Ministry of Health and Wellness, underscoring our commitment to regional collaboration in public health. As we gather here, I want to highlight the essential role that CARPHA continues to play in safeguarding the health of our people. As the region's leading public health institution, CARPHA plays a crucial role in disease surveillance, health security, and research-driven policymaking, strengthening our collective ability to respond to health challenges. A special acknowledgement to Dr. Lisa Indar, the newly appointed Chief Executive Director. The newly appointed Executive Director of CARPHA. Dr. Indar has been a dedicated leader in Caribbean public health, particularly in epidemiology and foodborne disease surveillance. We congratulate her on this well-done appointment and look forward to continued progress of CARPHA. I also take this opportunity to recognize Dr. the Most Honorable Kenneth George, Chief Medical Officer, who has been instrumental in guiding the national health policy and ensuring the well-being of our population. In his absence, I want to acknowledge the contribution. I want to recognize Senator the Most Honorable Jerome Walcott, Minister of Health and Wellness, and Senior Minister coordinating social and environmental policy. He's a visionary leader who's played a key role in strengthening health systems, not only in Barbados, but across the region. It is of note that he was also instrumental in the very creation of CARPHA, which makes his being part of this event in his absence significant. This year's CARPHA Health Research Conference will focus on a particularly urgent but often overlooked issue, the issue of mental health. Mental well-being is foundational to overall health, yet it continues to be under-prioritized and in some instances underfunded. This conference will provide a much-needed platform to advance discussions, share research, and advocate for policy changes that prioritize mental health in our region. As we recognize the importance of strong leadership in advancing public health, I want to invite at this time as our first speaker, Dr. the Most Honorable Kenneth George, to bring remarks. Dr. George.
Good morning, everyone. Good morning. Good morning, everyone. The Most Honorable Janet Phillips, Director General, Social and Environmental Policy. Mr. Wayne Marshall, Permanent Secretary, Ministry of Health and Wellness. Mr. Rashima Cheltenham-Niles, Director, Planning and Research Unit. Dr. Amalio Del Riego, PWR, Barbados and Eastern Caribbean. Dr. Lisa Indar, Executive Director of CARPHA. other members of the CARPHA team, senior members of the Ministry of Health staff, members of the media, ladies and gentlemen. Good morning.
Good morning.
It is an honor for me to deliver remarks at the kick-off and launch of the 69th Caribbean Public Health Agencies Conference. CARPHA has had a long and distinguished history supporting and advancing research in the region. And it is with great pride that we are here today. When I was first approached with respect to hosting the 69th Health Research Conference in Barbados at the 68th Health Research Conference in St. Lucia, I immediately notified Senior Minister Walker, who gave his full support. This, along with the full support of the Cabinet of Barbados, we are here and very proud to be hosting this event. CARPHA has been instrumental in supporting scientific and public health research for several decades. Through rigorous data analysis, research, and dissemination of information, CARPHA continues to shape the health policy agenda, not only within our region, but on the international stage as well. In addition to research, CARPHA is central to the provision of technical assistance to 26 member states in the region, including surveillance, epidemiology, port health, food and safety, vector control, NCD management, and of course, reference laboratory services. This conference provides a platform for a diverse range of researchers, from emerging scholars to seasoned experts. I'm aware that the call for papers started several months ago, and that selection process of research papers was rigorous, involving a panel of local, regional, and international experts, ensuring high-quality presentation. Moreover, CARPHA has prioritized ethical standards by ensuring all studies involving human subjects have met the ethical standards required for approval. Each year, a theme is chosen, and this year's theme, Mental Health, the Hidden Pandemic, is particularly pertinent. Mental health issues in the Caribbean have reached a critical level. Across the region, there have been notable rises in persons experiencing mental health conditions, especially among young people, with many individuals experiencing heightened levels of anxiety, depression, and stress. In Barbados, for example, there has been a 100% increase in the number of individuals seeking psychological and mental health services during and after the COVID-19 pandemic. This surge is reflective of a broader regional trend, where the impact of the pandemic has led to significant rises in mental health conditions. Additionally, studies show that neurocognitive disorders, such as Alzheimer's disease, affect over 50% of individuals in the elderly population by the age of 80. And this percentage increases significantly as they grow older, reaching upwards of 70% by the age of 85. In response to these challenges, Barbados has introduced measures such as the mental health hotline and has expanded its child guidance services at the Child Guidance Clinic to 3 days a week. And indeed, it's up to 5 days a week if you consider the other staff that give support. In addition to taking proactive steps to explore and expand mental health and dementia awareness initiatives, the ministry remains committed to supporting all mental health services in Barbados. These initiatives have proven successful in addressing some of the immediate needs in the community, but so much more needs to be done. The scars of the COVID-19 pandemic will be with us for a long time, and it is essential that we continue to expand and promote mental health services across the region. With over 170 accepted papers, this conference promises a wealth of knowledge. I encourage not only academics, but all individuals and organizations who value the expansion of scientific knowledge to engage in this conference. In closing, let me extend my gratitude and congratulations to the appointment of CARPHA's new Executive Director, Dr. Lisa Indar, for her willingness to partner with the Ministry of Health to ensure that we have a memorable research conference in Barbados. Indeed, Barbados last hosted this conference about 12 years ago. Finally, I look forward to welcoming chief medical officers from across the region to Barbados for a CARICOM hosted meeting addressing pressing public health agenda of the region, which will take place prior to the Health Research Conference. Thank you for your attention. I anticipate a fruitful and impactful conference ahead. Thank you so much.
Thank you, Dr. George. Next, I'm honored to invite Dr. Lisa Indar, Executive Director of CARPHA, to the podium. Dr. Indar has dedicated her career to strengthening health security in the region. Her expertise and leadership continue to shape CARPHA's work to safeguard the health of our region. Dr. Indar.
Yes, so much. The Most Honorable Janet Phillips, the Director General, Social and Environmental Policy. Mr. Wayne Marshall, Permanent Secretary of the Ministry of Health and Wellness. The Most Honorable Kenneth Flood, the Chief Medical Officer, who I might say works really well with CARPHA. Dr. Arthur Phillips, the Deputy Chief Medical Officer and our moderator. Senior officials, other senior officials from the Ministry of Health and Wellness. Dr. Amalia Del Rigo, my good friend, the FAHO WHO representative for Barbados and the Eastern Caribbean and other representatives from FAHO. Dr. Mark Sami, the Director of Corporate Services, and other staff from CARPHA. Public health partners and members of the media. Ladies and gentlemen, good morning. Good morning. It is my pleasure to welcome you, to bring greetings to this important media briefing, and to be here in Barbados, known for its exquisite beaches, Harrison's Caves, its UNESCO-listed Garrison Historic Area, of course, cricket, amongst so many other attributes, and whose well-renowned Prime Minister, the Honorable Mia Mottley, is the current chair of CARICOM. Dr. George, Barbados was the obvious choice. It was our first choice, and it was the obvious choice. CARPHA, the Caribbean's sole integrated public health agency, in partnership with the Ministry of Health and Wellness of Barbados, is hosting its 69th Annual Health Research Conference at the Lord Erskine Sandyford Center from the 7th to the 9th of May, 2025. I feel very proud to announce this. The CARPHA Annual Health Research Conference is the largest health research conference in the English-speaking Caribbean and the longest health research conference in Latin America and the Caribbean region. The goal of this conference is to enhance knowledge, facilitate and promote sharing of scientific outputs among our health scientists, policy makers, and related professionals in the wider Caribbean region, which then provides the impetus for prevention, control, and policy interventions for improving health and well-being. Historically, the conference is rotated throughout CARPHA member states. Barbados last hosted this conference in 2013. This year, the theme is mental health during the pandemic. Mental health is a global public health issue. It includes not only the traditional focus on individual therapy interactions, but also emergent frameworks designed to address mental health at the population health level. Health is shaped by a plethora of determinants: gender, genetics, socioeconomic status, education, physical environment, social supported networks, access to health services, and now crime and violence, all of which operates at the individual, family, community, health systems, and societal levels. Because these determinants of health affect not only the physical health, but also psychological health, it's imperative in public health to gain a better understanding of the many pathways which determinants of health impact the psychological well-being of large groups of individuals. Mental health thus touches each and every one of us, whether personally or through our loved ones or within our communities. It impacts on how people relate to each other, make decisions, and handle stress. People's ability to live fulfilling lives often depends on their mental health. This makes protecting and restoring mental health of immediate concern to public health professionals, and with increasing impact, and especially after the aftermath of COVID-19 pandemic, which we know to have significantly impact on mental health in the region. This conference promises an exciting and stimulating agenda with 83 oral and 86 poster presentations covering mental health as well as other public health issues that impact on health systems, including policy, planning, public health, non-communicable and communicable diseases, which are currently impacting the region. There will also be a special panel discussion and feature lecture on mental health on day one of the conference, as well as special session on the pandemic fund and other infectious diseases. The government of Barbados, Ministry of Health and Wellness, also promises an exciting cultural and social event at the opening ceremony to be held on day one of following the conference. The conference will also allow for a unique opportunity for international, regional, and national public health professionals and researchers, allied and other stakeholders, including the public, to discuss and explore solutions for mental health and other current public health concerns. In addition, local, regional, and international organizations and companies will be showcasing and presenting their programs, innovations, products, and services. This all provides a very unique opportunity to network with delegates from across the Caribbean, Latin America, North America, Europe, and beyond. Finally, the conference will end with a special awards ceremony on Friday, May 9th. Therefore, I strongly urge all Caribbean health professionals to register now to participate in this significant regional public health event that just should not be missed. Early bird registration ends March 31st, which is just about 2 weeks away. Please visit the conference website today at conference.carpha.org to register and secure your spot at the conference. I also encourage nationals and residents of Barbados to take advantage of the special rates offered to attend the conference. Finally, CARPHA graciously thanks the government of Barbados, and especially the Senator, the Most Honorable Jerome Walcott, whose leadership has been important, significant, not just from the establishment of CARPHA, but in convening and approving the convening of this conference, and the awesome team at the Ministry of Health and Wellness for partnering with us to seamlessly host this event. Thank all who have joined today. We want to thank the media for the important role in disseminating this information and attracting a diverse and engaged audience. I look forward to seeing all of you at the LESC on May 7th. Thank you very much.
Dr. Indar. At this time, it is my distinct pleasure to introduce P.S. Marshall to deliver remarks on behalf of Senator Most Honorable Jerome Walcott, Minister of Health and Wellness and Senior Minister coordinating social and environmental policy. Minister Walcott has been a steadfast advocate for strengthening regional health systems, and as was mentioned, is one of the architects behind the creation of CARPHA. His leadership continues to advance policies and to advance and enhance healthcare delivery and security in Barbados and beyond. P.S. Marshall, welcome your remarks.
All having been established, I'd like to say a good morning and a warm welcome to all. It is my privilege this morning and honor to stand before you and prepare to host the 69th Annual Health and Research Conference, co-hosted obviously by the Government of Barbados through the Ministry of Health and Wellness and the Caribbean Public Health Agency, CARPHA. Let me extend apologies on behalf of Senator Mr. the Most Honorable Jerome Walcott, Minister of Health and Wellness, and Senior Minister coordinating social and environmental policy, and the Honorable Davidson Ishmael, Minister of State in the Ministry of Health and Wellness, who would have liked to be here this morning but could not make it due to conflicting engagements. Now, my speech has already been read due to the three speakers that have been before me. So my job has become quite easy this morning, but nonetheless, I will say the few words I have to say. At the outset, just like my colleagues, I want to wish on my own behalf, as well as the behalf of the Minister of Health and Wellness, to congratulate Dr. Indar on her appointment as the new Executive Director of the Caribbean Public Health Agency. And it became effective on February 1st this year. Dr. Indar's appointment is a significant milestone for the public health community. Her impressive tenure as interim executive director since July 2024, and her remarkable leadership as Director of Surveillance, Disease Prevention and Control since 2019, Dr. Indar consistently demonstrated her dedication and expertise in public health. Additionally, her invaluable contributions as the head of the Regional to Regional Health Program since 2014 have significantly advanced the health and wellness of our region. Dr. Indar's outstanding achievements and commitment to public health made her the perfect fit for this role. We look forward to her continued leadership and visionary guidance as we strive to address the health challenges of our time. Congratulations once again, Dr. This year's theme, Mental Health, Hidden Pandemic, underscores the critical importance of mental health as we navigate the complexities of today's world. Government of Barbados, as was indicated before, last hosted this prestigious conference in 2013. But we are thrilled once again to bring together a diverse group of health professionals, researchers, and policymakers from across the region and the globe. This collaboration with CARPHA ensures that the 69th Annual Health Conference and its pre-conference events, including meetings and training workshops, will be a platform for sharing groundbreaking research and clinical findings that can significantly influence public health policies. The conference's sessions will delve into various aspects of public health, with presentations on family health, infectious diseases such as vector-borne diseases and non-communicable diseases. These sessions will not only provide valuable insights, but also foster full discussions on priority public health issues, stimulating thought and action on how best to address these challenges. We at the Ministry of Health are committed to advancing a robust research culture among local, regional, and national health and allied health professionals. This conference will serve as a forum for establishing mentorships, partnerships, and collaborations that will strengthen the capacity of researchers involved with research grants, conduct impactful research, and utilize these findings effectively. Presence of regional and national delegates, meeting attendees, and sponsors involved in this is not only a testament to the significance of this conference, but also an opportunity to showcase our beautiful culture and attractions. We hope that many of our delegates will return as repeat visitors, further enriching our cultural exchange. We are also pleased to mention, and there's a little tab, CARPHA, special rates for national and residents of Barbados, making it more accessible for our local professionals to participate and benefit from the world-class event. Additionally, the conference provides sponsorship and exhibition opportunities for companies and organizations to gain valuable exposure, showcase their brands and activities, and connect with diverse audience. So I said it was going to be short. So in conclusion, we extend our deepest gratitude to CARPHA, our sponsors, and all the participants who will make this conference a resounding success. Let's all work together to elevate the discourse of mental health and other critical public health issues, fostering a healthier future for all. Thank you very much.
Yes, Marshall, for delivering those remarks on behalf of Mr. Walcott. Absence. Want to transition at this time into a question and answer segment, giving an opportunity for our colleagues in the media to engage with our distinguished panel on the issues raised today, as well as the broader agenda of the upcoming conference. I'll just ask that as you introduce yourself, you state your name and your media affiliation before posing your question. Thank you.
Yara Springer, Asian Publishing. Dr. George, in your remarks, you mentioned that there was a notable rise in the mental health challenges, especially as it relates to the younger demographic. Can you share any causes, were there specific reasons as to why this particular demographic was experiencing these challenges?
So thanks for your question. The etiology behind mental health disorders is very varied and complex. The etiology behind etiology or root causes behind why mental health affects various levels of the population is very complex. There's no straight answer. What we have found is that during the COVID and long after the COVID pandemic, there was cry out from people for mental health services. And we tried to rise to that challenge. We have increased our community-based presence with respect to mental health. As I mentioned, the child guidance clinic is important because we know some of the issues that have been brought, put in the public space. And we continue to provide long-term services for persons with mental health. We are in the process of reviewing with the Pan American Health Organization mental health legislation. Because the mental health legislation in its current form is archaic and does not promote a rights-based approach. So we are also working on a strategic plan for mental health in Barbados. So mental health has come to the forefront And countries across the region have been asked to rise up to the level of services that we are able to render. What I would say is that the Ministry of Health will continue to do whatever it can to support young individuals who present challenges. It's difficult, as I say, the years are complex. There may be certain triggers that occur in the relationship. The good news is that there has been some advocacy with respect to mental health services. One that comes to mind is Let's Unpack It, which is a group of young people trying to advocate better mental health services. And we so far appreciate what they are doing. And under the guidance of the Director General, she is doing a special with Let's Unpack It to review and advance mental health challenges within.
Carl Rose from Starcom Network. Dr. George, I know you mentioned that there's 100% increase of people seeking treatment post-pandemic. Can you say specifically what numbers represent the youth in that 100%?
Sorry, I will get back to it. Just as a comment on the text of it, what you've noticed is that generally, and I spoke about the scars of the pandemic, because we have noticed the mortality rate in Barbados, mortality patterns change. And there, as you know, there is a lot more non-communicable disease, more sudden deaths, more persons presenting with end-stage disease. So I think I'm not blaming it all on the COVID pandemic. Certainly, we are seeing these effects, and we hope that we can turn this corner soon. And therefore, whenever I have the opportunity, I need to let persons know that in these times they need to take care of themselves, because we are living in very uncertain times. And sickness and ill health in the population has seen a lot. We as a ministry are committed, not only myself, but I fortunately have a team of competent public health professionals who try to do their utmost best to ensure that whatever support we can do to the population is provided. Thank you.
Shamar Blent from Barbados Today. And this question is both for you and obviously Dr. Indar. Also, we've spoken a lot about the responses from health authorities in terms of obviously behind this mental health issue that we're currently seeing in the region. But I want to focus a little bit more on the responses more from businesses. I know here in Barbados, we have a wellness policy that we've been trying to get Affinity businesses obviously to get business on board in terms of, taking better care of their employees' mental health. But in terms of the responses and support, what have you been seeing locally and obviously regionally in terms of have businesses been coming on board to, do better, or do you still see this hesitancy in terms of them taking it seriously?
Businesses are more aware and they're more supportive. We have not only tapped into the business community, but we are trying to encourage NGOs. And I don't know if you know, this conference will have University of the West Indies as part of the because we recognize that it's not only the business houses. Mental health has always been considered in public health as the correlation. This is kind of George speaking. But I believe that we have turned that corner. Why? Because persons are more willing to speak out about their experiences. So over time, the private sector will come on board. It's usually a shift. They're on board with the NCD agenda. And it's only time that they will seem it fit to come on board with the mental health agenda.
Thanks. So from a regional level, I can't directly speak to individual businesses and so on. But what we can say from a regional level, as Dr. George says, like for Barbados, there's that increase in, knowledge and awareness. And this is what CARPHA, and in collaboration with our partners, PAHO, and others, and our countries are working on. You're creating that awareness that, that is not a phobia anymore. That, that mental health is something just like any other issue, public health issue, and that we should address it, and we should address it in a open space without, criticism. Part of what CARPHA is doing, again, and in collaboration with our partners, is to treat mental health just like exercise, just like how you're taking care of your body, you have to take care of your mind. So concentrate and focus on how do you relieve stress? How do you foster good relationships? Half our lives are spent at work and the other half at home. How do you foster that? You can't take all the stress home. You have to, when you go home, build those meaningful relationships at home. You have to have meaningful relationships at work. And how do you de-stress? Because it's a combination and it's a complex interplay of the physical and the mental well-being and all the factors that is impacting, your access to health, your social factors and so on. So we are building that awareness, and at CARPHA, mental health is now regarded, and we've been pushing it as a public health priority. This is the reason we had this conference, and we are building partnerships, we are building strategic alliances, and building it into our NCD program as well, as part of that component as we go forward. Thank you.
Okay. There's a question online. Thank you so much. David Johnson, MD, President, let's unpack it. Good morning all. Given the rise in the incidence of mental health conditions amongst children and young people across the region, how will young people be engaged at the conference? And beyond the conference, what steps will CARPHA, the Ministry of Health and Wellness Barbados, be taking to engage children, young people as key stakeholders? Thank you, Dr. Johnson. That's for Ministry of Health Barbados and for CARPHA.
When Barbados hosted SIDS conference, we took a strategic decision to include the youth in that one. And they were well represented and had an equal place in the field. With respect to CARPHA's conference, I think Dr. Indar has signaled her willingness to partner with organizations similar to those organizations which have a youth focus. We in the Ministry of Health understand the need of voice. For example, when we did the school nutrition policy, they were engaged, they were not left. And I think that as we go forward, we will try to include them in any big policy decisions. It's just acceptable and the way to go in modern times. So thanks for your intervention, and we will continue to give support wherever necessary. Finally, before I close out, we are developing an adolescence policy for us. who has been strategic, giving us the technical support. I think the document is fairly well advanced. The challenge with young people is that from an adolescent's perspective, we need to be strategic in how we reach them. We are not going to reach them through the clinics or the older methods how we deliver it. We have to meet them where they are and understand their communities to deliver appropriate healthcare. The healthcare we would like to target that group would be sexual and reproductive health. Obviously, mental health are the two big issues in. So thanks for your comments. We have taken them on board. We will keep this in the forefront.
I want to echo the sentiments of the Chief Medical Officer with respect to the engagement of the youth in the CIS conference. But for this conference, the CARPHA Health Conference, we sought to replicate what was done at the CIS conference, and we're going to engage the youth in a youth forum, which will take place prior to the CARPHA conference. Additionally, we have approached CARPHA with respect to including a number of young persons as part of the attendees or participants of the CARPHA conference, and they have accepted that. So we have considered the youth. We know that very often persons do not bring the youth into their focus, but we at the Ministry of Health are seeking to do that in all of our programs and initiatives. And this is only one area that. Thank you very much.
So I think both PS and CMO has adequately answered that. To add to this, we see youths being so important to mental health. Sometimes we forget, that as adults, we have all the stress in the environment, but as a younger person, it's even harder for them to deal with, and there are situations where we might be able to deal with better because of our experience and our years of experience, but a breakup or someone not passing their exams and simple things may impact on a youth differently and also impact on their mental health and well-being. So as Dr. George says, we have to look at it differently, and we're committed, not just Barbados, but with PAHO, to look at how we can develop a targeted program that allows us to address what is happening in terms of youth mental health and do it in an adequate manner. We also have the Research Advisory Committee, and they will also be presenting at our Chief Medical Officer's meeting about policies and intervention, and this will be considered as well. So we're looking at it a whole holistic way, but also targeted what specifically does apply and aligns to the population. Thank you.
There aren't any further questions from media. Thank you, dear colleagues. As we conclude this media launch, I want to extend my gratitude to our speakers, Dr. George, Dr. Indar, PS Marshall on behalf of Minister Walcott for their insightful contributions. Thank you, particularly to the media for your attendance, your questions, and to all of our attendees here today for your engagement. Said the 69th CARPHA Health Research Conference will take place in Barbados in person modality from the 7th to the 9th of May. This is to be a landmark event addressing one of the most pressing health issues of our time. We encourage all stakeholders to take the opportunity to participate, share knowledge, and to contribute to the important discussions that will shape the future of healthcare in the region. Thank you. And at this time, we invite the media to engage the head table for a photo opportunity. Thank you very much.